52-year-old patient hospitalized for a week secondary to acute ischemic stroke. 1 week into hospitalization, he develops fever, purulent cough. Vitals are kind of normal with presence of fever. On physical exam, he has bilateral crackles on right side of chest. Chest X-ray shows new consolidation obscuring the right heart border. Barium esophagogram showed few tertiary contraction but no evidence of aspiration. A complete blood count shows that hemoglobin, hematocrit are normal. WBC are raised with increased neutrophil and band cells. Platelet count is slightly increased. Which of the following is causal microorganism? Pseudomonas aeruginosa, Streptococcus pneumoniae, Mycobacterium tuberculosis, Haemophilus influenzae, or Staph aureus. So, very important to understand over here is what is going on. So I think that most of us got it that this patient is having pneumonia. Okay. So what is going on? This patient had stroke. He was there in the hospital for 2 days, right? 48 hours. And after that, he started developing fever, cough, and on chest X-ray, there was some kind of consolidation present. Then all inflammation can be seen through increased WBC and all that. So this surely shows that this patient came to hospital due to ischemia, and after 48 hours, he developed pneumonia. Let's see. So it's important to understand that pneumonia can be classified into various types. Okay. Okay. If a patient comes to hospital and after 48 hours in hospital he develops pneumonia, the patient should not come with pneumonia. He should be in hospital for 48 hours without pneumonia and after that develop pneumonia. In that case, we call it as hospital acquired pneumonia. If there's a person who is on ventilator and after 48 hours of intubation, endotracheal intubation, he develops pneumonia, in that case it is called ventilator associated pneumonia. Healthcare associated pneumonia, this is an old definition. These days we do not classify health associated pneumonia and healthcare associated pneumonia as different. Both are considered same. Like if you develop pneumonia in any setting which is hospital related and after 48 hours of admission, then it is called health hospital acquired pneumonia. This is an old definition, do not go by that. Then there is community acquired pneumonia. Basically, you develop pneumonia outside of hospital. So in this case, what is going to happen is that patient is going to come with complaint of pneumonia. Here, what happened in our case is patient came with history of stroke and initially didn't have pneumonia, and after that being admitted for stroke for 48 hours, he developed pneumonia. So this is hospital acquired pneumonia, this is community acquired pneumonia, and this is ventilator associated pneumonia. It is very important to distinguish between community and hospital acquired pneumonia because the causative agent for both of them are different. Like basically all of them can cause all of things. The most common organism that causes hospital acquired pneumonia or community acquired pneumonia are different. So hospital acquired pneumonia is most commonly caused by Staph aureus. The most common agent is Staph aureus. Okay. The next common agent is Pseudomonas. So I think Pseudomonas does cause the hospital acquired pneumonia, but it's not the most common cause. So as in this answer it is written that 6 organisms cause around 80% of hospital acquired pneumonia. So the main cause is Staph aureus. Most common is Staph aureus, followed by Pseudomonas, followed by Klebsiella, then E. coli, then Acinetobacter, and then Enterobacter. Pseudomonas is most common cause of ventilator associated pneumonia. Most common cause of community acquired pneumonia is staph pneumonia. So you have to remember this. Hospital acquired pneumonia, most common cause Staph aureus. Ventilator associated pneumonia, most common cause Pseudomonas. Community acquired pneumonia, most common cause strep pneumonia. And you have like how will you understand whether this is community acquired or whether this is hospital acquired? It is important that you see the timeline. If the patient complains comes with a complaint of pneumonia, or within 48 hours develop pneumonia, then it is community acquired. If he develops pneumonia after 48 hours, if by developing pneumonia, what do we mean by developing pneumonia? He'll start presenting with features of fever, cough, um, and other feature, and then on next day you will see a new consolidation which was not present when the patient was admitted, and he developed a new consolidation. That is how you will realize that this is hospital acquired pneumonia, not community acquired pneumonia.
Thanks for watching. Please give a thumbs up and subscribe for more.